So we're actually looking at the next stuff here, which we are discussing, and this is honeymoon cystitis. So honeymoon cystitis, I'll actually just share you guys a very funny story that our lecturer shared with us in class, so that you just understand the honeymoon cystitis once and for all. So honeymoon cystitis, our lecturer explained a very funny scenario. He said that if couples are newly wedded and they go for honeymoon, so they are just in a fine hotel, just them, okay, so there's nothing to do. Probably the husband just have some laptops that are just following up some business online. The wife too is just following up some business online. Probably they are spending like 1 week together after being newly wedded. So they are excited that they're actually newly wedded, so there's nothing to do, and these people are just having sex back to back to back to back. So this can actually lead to, as a result of so much sex, all right, so bacteria is being pushed from the vagina into the cervix, into the up the urinary tract, okay, and also the reproductive tract. So bacteria could actually be pushed back into the uterus, especially can be pushed back into the bladder, okay, leading to inflammation of the bladder. So there's inflammation of the bladder as a result of like too much repeated sex. Okay, that was the scenario he shared with us. So we said that it's a colloquial term for urinary tract infections that usually occur after sexual activity, particularly in women. So that means one of the conditions for a woman to have this is, she has not been having sex before marriage. So this is the first time that she's experiencing so much sex. I don't know if you understand me. So if it is a bride that has lost her virginity repeatedly back then, she won't really have this, So the term comes from the observation of urinary tract infection often occurring during after a honeymoon, when sexual activities were so much increased. That was the funny story I was sharing with you guys. So it's not limited to only newlyweds, okay? So anybody that usually involves in vigorous activity, sexual activity, could actually be affected. So the cause and mechanism is usually the bacterial entry. So bacteria are being pushed back, okay, the urethra back into the bladder. So for the females, it's easy because their urethra is short. Do you understand? So the vigorous sex usually disrupt the normal vaginal flora, okay, so this could also lead to issues. So there's burning sensation during urination, frequent urge to urinate, lower abdominal pelvic discomfort, cloudy or foul smelling urine. Then sometimes the bacteria could move into the bloodstream a little and cause some fevers. So diagnosis is urinalysis, urine culture. Just want to identify the microorganism. Then use antibiotics like nitrofurantoin, trimethoprim combined with sulfamethoxazole, okay, or phosphomycin. Then use pain relievers like phenazopyridine, okay, just to ease urinary discomfort.